Dr. Basehore, welcome.
Thank you. Thank you for having me.
Why did you choose dermatology?
Well, for a few reasons. The first is dermatology is a window to the inside of the body, and there's a lot of systemic diseases and illnesses that present with skin findings. So it allows you an opportunity to play detective to see if what we're seeing on the skin is actually a problem with the skin itself, or rather it's a manifestation of disease inside the body. So it allows you to challenges you to think and play detective to see what exactly is causing what you're seeing.
Nice. So did you always know you wanted to be a dermatologist, or did this happen later on in your career?
Well, I had a few options that I was interested in between dermatology, plastic surgery, and orthopedics. I do like the aspects of the procedures and being able to do surgery that I enjoy, but I like dermatology because it actually, what most people don't realize is there's more diseases in dermatology than any other specialty. So there's a lot of knowledge that has to go into learning that. And it's not just technical surgical skills. It's actually thinking about what could be going on, and the wealth of knowledge that is required to be competent in dermatology, I feel like is more challenging. And overall, being in an outpatient setting is a little bit more relaxed than being in the OR. So
It really is. And you did a lot of your training in South Florida.
Yes, sir.
So you saw a ton of skin cancer and a ton of different skin conditions because the population there is so diverse.
Absolutely. So training at Broward General Medical Center is one of the largest hospitals in South Florida. So in addition to the tons of skin cancer that we see from the years of sun exposure down in the South Florida beaches, we were exposed to a wide population diversity. So we have a lot of patients from the Caribbean coming in. We have Hispanic community, diseases that are only seen or seen more often in certain ethnic populations. The exposure to that, as well as training under Dr. Carlos Nassari, we did a lot of, we saw a lot of patients with autoimmune diseases. So I feel like my training was adequate to prepare me for whatever walks in the door. I'm comfortable to treat, or at least to have an idea of what's going on and how to figure out how to fix it.
Awesome. I think one of the biggest things about your training is knowing enough to know how much you don't know. Right? That's the point at which you're ready to go out into the world. When you realize the scope and breadth of a topic, then you're ready to actually take care of people. And it's great to have an experience where Nassari is one of the giants in the field. Mm-hmm. So you were lucky enough to train under one of the giants. So what's the difference between South Florida and Colorado? Like, not medically, but what have you noticed the difference, and why did you come to Colorado?
So why I wanted to come to Colorado is I love the outdoors, and I love the lifestyle. People here seem to want to get outdoors and be involved and be active. Personally, I love any outdoor recreational activity, whether it's snowboarding, hiking, fly fishing. There's not a whole lot of outdoor activities if you don't own a boat in South Florida. And being a resident, you can't necessarily afford those things. Sure. In South Florida at the time. But
unless it's an inflatable thing that you blow
exactly,
up.
Exactly.
Right.
But no, I've always loved Colorado. I lived in Vail for a year between undergraduate and medical school, and have always been looking at ways to make my way back here. After a long detour back to the East Coast, I was finally able to make it out here to Colorado. Thanks to you for inviting me out here, and I'm very grateful for the opportunity.
Awesome. And in your training, you did a lot with military populations, because you actually worked and trained at a VA. So you're very familiar with the military population, and Colorado Springs is If it's not the biggest, it's the second biggest military population in America. So.
Absolutely. We had rotations at the West Palm Beach VA every year, 2 or 3 months that we spent working with the veterans there. And growing up in Williamsburg, Virginia, there's a large military population in that area as well. So it's a population that I love working with. The veterans are always very appreciative of the care that you provide them. And I'm excited to have the opportunity to be in a community and be around similar type of feel here in Colorado Springs.
Absolutely. All right, so this is the opportunity where you get to put on the all-knowing, all-powerful hat for a second. If you could ask everybody to do just one thing so that they wouldn't need medical care, not necessarily dermatology, but wouldn't need our services in the first place, what would that be? That all-knowing, all-powerful cap. What would you put forward?
That's a tough question, putting me on the spot.
Yeah, absolutely.
I would say that probably taking care of ourselves and taking into consideration lifestyle and how it can affect our own health. So things like being active, eating healthy. As an osteopathic physician, we learned that the body has an innate ability to heal itself.
Absolutely.
And we have to give the body an opportunity to heal itself and to be healthy. And to be able to do that, we have to support it. So the biggest thing I think is living a healthy lifestyle, eating healthy, staying active. I think these are all things that contribute towards overall positive health.
Absolutely. I mean, motion is lotion for the joints, and it's good for the soul, it's good for the heart, it's good for your spirit. I mean, and I think that's one of the key things about osteopathic physicians is we're trained in everything that the MDs are. But we also perhaps have a little different perspective of we are not the people coming in and fixing things. We're the partner coming in and hopefully partnering with the patient's body and figuring out how we can encourage the patient's body to heal on its own. We can be that little extra positive nudge in the right direction. And I think that that's a pivotal difference, because one philosophy is I'm there to help. The other philosophy is I'm there to fix. And when you help, you end up fixing, but it's not through a forceful way. It's through a encouraging, building up, mutual partnership way. And by no means do the osteopaths have the lock on that. No, not at all.
Absolutely not.
But I think our training encourages that a little bit more.
Absolutely. I think taking the holistic approach in general, as I touched on with lifestyle and living a healthy lifestyle, I feel like there are ways that even in dermatology that we can enhance that homeostasis inside the body to allow it to heal.
Sure.
One of my favorite products that I recommend to a lot of patients is nicotinamide, as I've talked with you numerous times about. This is a simple over-the-counter vitamin, but as we're starting to learn more about the potential health benefits, it's something that is an easy supplement in the day that we can encourage patients to take to allow their body to get more nutrients that it needs to help support healthy skin and healthy rest of the body as well.
Absolutely, and it's a special form of vitamin B3, right? So it's just kind of these extra little trying to help, trying to support, trying to encourage, trying to daily do the little preventative strategies, if you will, changing your oil, changing the oil of your body so that we can live a longer, more productive, healthier, more enjoyable life, instead of just waiting for disease to happen and then we have to intervene. So,
I like the changing the oil analogy you use. I use that a lot with my patients. I say that when it comes to just coming in for regular skin checks, just like you would regular health screenings with your primary care doc, if you don't change your oil every 3,000 to 5,000 miles, you run into trouble down the road.
Absolutely.
Just like coming in and seeing your primary care provider, getting regular skin checks. It's not necessarily to fix things, it's to help make sure that we stay ahead of it before we have to play catch up later on.
100%. I mean, what is it? An ounce of prevention is worth a pound of cure. 100%. So awesome.
One
last closing thought, comment.
Absolutely. Oh, for me?
Yeah, from you.
Well, I'm just super excited to be here. I'm very excited. All the patients that I've worked with so far have been wonderful. I look forward to the many patients that I've yet to meet that are out in the community. I have no intentions of going anywhere anytime soon, so I'm here for the unforeseeable future.
Sure.
And looking forward to building that relationship with the community and my patients to give them the support they need. And in return, they support me because they are very welcoming and in having me to Colorado. And so I'm happy to be a part of the Colorado Springs family.
That's awesome. It's great to have you. And it's so, I mean, patients can feel when they come here that we're here to help. And we are so appreciative and grateful that you allow us to practice our art, to practice what we've spent our whole lives getting to the point of earning the right to be heard by you. And so I'm going to echo Dr. Basehore's gratitude and thanks and saying thank you for allowing us to practice our art.